Now I want to quickly define something and talk about the meaning. So this is coming. If you say there's a 3-person move for patient, 3-person move for a patient, okay, generally in the lab or in the hospital ward, but here we're trying to focus on radiology, right? So what does it mean? So this is just simply what a 3-person move for a patient is. 3 people are holding the patient, mostly one at the thorax region and the head region. Then next we have it at the pelvis and perineum region at the back, then the other one at the lower limb. Okay, so 3-person move in radiography is just a safe patient handling technique. So of course the patient that you are carrying like this is a patient that is extremely so ill or has a lot of fractures. Do you understand? So it's usually applied for a patient that's immobile. The patient cannot be able to walk by themselves to the lab. You know, the patient is unconscious. The patient is unable to assist themselves in general. You know, so they now carry the person to the radiographic table or the imaging surface. So it's a manual transfer method and it involves 3 people. Okay, mustn't be only radiographers, but you could also just call the healthcare staffs and give them instructions so that they could help you. So it's used when the patient cannot move independently. Maybe there's too much trauma, the patient is in ICU, intensive care unit, and probably sometimes after an operation the patient feels so weak, So it ensures spinal alignment. Okay, most of the times the patient has issues on the spine, so you don't want to dislodge, So it provides weight distribution, reducing strain on the staff. So sometimes one person could be able to carry the patient, but probably the patient is so big, so you employ 3 people in that. This is it. 3-person carry, lift. Okay, call it a stretcher lift or 3-person carry. So how the 3-person move for a patient works is the positioning staff, 1 person at the head and shoulders, 1 person at the hip and the lower back, just like I was explaining. Then 1 person at the legs and the feet. So the leader counts. You have to count 1, 2, 3. Then you go. Do you understand? So that to actually the whole thing is actually uniform. So all 3 of them will now lift or slide the patient simultaneously, and this will actually give it a one-way effort, right, and help to align the spine. So the patient is gently transferred from the stretcher or bed to the X-ray table. And after you're done, you see transfer the person from the X-ray table back to their place. So it's commonly used in trauma radiography when the person has other spine issues. Also mobile radiography when the patient is too ill. Essentially old patients. Somebody could have Parkinson's, a lot of things. We're just trying to list examples. A lot of conditions could actually make you want to do this for a patient. Key principles is you're trying to keep the patient's safety topmost. You're trying to communicate. It's a teamwork. Then you're trying to make sure that the patient's body is not moved anyhow. Do you understand? So that's what we have for a 3-person move for patient in radiography.